Welcome and thank you for taking the time to complete this important training module as part of the University of Windsor's Safe Return to Campus plans. Students play a vital role in these plans and in helping to prevent the spread of the COVID-19 virus. This presentation will cover the following information: COVID-19 virus and how it is transmitted, the symptoms and risk factors to consider. We will review infection control measures as part of the university's Return to Campus plan, and key actions that students can take to help prevent the spread of COVID-19 on campus, as well as additional information and resources consulted. This presentation will cover infection control measures implemented at the university, key actions that you can take to prevent the spread of COVID-19 on campus, responsibilities of all parties with respect to health and safety in the workplace, important resources for more information. The University of Windsor is committed to providing a safe, respectful, and healthy workplace and learning environment for workers, students, and community members. The university strives to promote a strong culture of safety that facilitates the awareness of risk and the prevention of injury and illness. In these exceptional times, health, safety, and wellness are crucial to our university mission. As part of the university's commitment to a safe and healthy campus, COVID-19 vaccinations are mandatory for all students, faculty, staff, and visitors effective fall 2021. The first part of this presentation will cover general information about the COVID-19 virus. COVID-19 is a new disease that has not been previously identified in humans, first identified in December 2019. Those who are infected with COVID-19 may have little to no symptoms. You may not even know you have symptoms of COVID-19 because they are similar to a cold, flu, or even allergies. Some individuals are more at risk of getting an infection and developing severe complications due to COVID-19. Vulnerable populations may include older adults, persons with underlying medical conditions such as heart disease, hypertension, diabetes, chronic respiratory diseases, or cancer, persons with compromised immune systems from a medical condition or treatment. Symptoms may take up to 14 days to appear after exposure to COVID-19. Symptoms of COVID-19 can include cough, fever, shortness of breath, chills, sore throat or difficulty swallowing not related to a known cause or condition, lost sense of taste or smell, pink eye, digestive issues not related to other conditions, extreme tiredness that is unusual. Most people contract COVID-19 from interacting with someone who is infected with COVID-19. Based on this fact and the available evidence, COVID-19 spreads when someone infected with the virus coughs, sneezes, or talks close to another person. The other person can then get sick if they inhale the droplets with the virus, or through contact such as shaking hands with an infected person and then proceeding to touch your nose, mouth, or eyes. Although it may be possible to spread the virus through contact with contaminated surfaces, this is not thought to be a main way. The virus that causes COVID-19 is most commonly spread from an infected person through respiratory droplets generated when they cough or sneeze, or through close contact through touching or shaking hands. It can also be transmitted when a person touches something with the virus on it and then touches their mouth, nose, or eyes before washing their hands. Recent evidence indicates that the virus can also be transmitted to others from someone who is infected but not showing symptoms. This includes people who have not yet developed symptoms, i.e. pre-symptomatic, or those that will never develop symptoms, asymptomatic. While experts know that these kinds of transmissions are happening among those in close contact or in close physical settings, it is not known to what extent. This means it is extremely important to follow the proven preventative measures. We will discuss these in the next section. The next segment of our training will provide an overview of the infection control measures implemented at the university. A risk assessment of the work or learning activity will be conducted prior to the resumption of work and classes. A return to campus plan or checklist must also be developed by each department, faculty, or unit and approved by authorities. Return to campus plans, checklists, and implemented control measures must be communicated to staff and students who enter the space. Supervisors and instructors in class settings must also ensure the control measures are being adhered to. COVID-19 has presented all of us with challenges we have never seen before. It is important to consider that any of the adjustments we are making today may need further adjustment tomorrow based on public health directives. The university will review their COVID-19 prevention plans on an ongoing basis and adjust them as required. The same applies for each faculty, department, or individual unit. The university is conducting a zone and flow analysis for all campus buildings. The zone analysis looks at determining the maximum occupancy of work areas, classrooms, and common areas, and considerations for physical distancing measures. The zone analysis also considers the redesign or modification of work areas if required. Some examples are workstation spacing, installation of barriers, workplace signage, and restrictions to common areas. The flow analysis looks at physical distancing measures needed for the established traffic flow of the building. The flow analysis evaluates designated building entrances and exits with hand sanitizer readily available, reduced or limited entry points with controlled access by fob, assessing the directional flow and traffic patterns in campus buildings, staircases and emergency exits, directional signage such as one-way hallways, staircases, and floor markers. It is expected that all individuals on campus are to follow the health and safety directives provided by the university, including being mindful and aware of posted signage and protocols, engaging in screening protocols, illness and absence reporting, participating in safety training if required, following directional signage and floor markings. Be mindful of restricted closed spaces. Be aware and follow procedures and protocols, including the use of personal protective equipment and community protective equipment as required. If you see something hazardous, tell someone. That could be your instructor, campus police, or the Office of Student Experience. The university's Facility Services Operations Group has established a COVID-19 Custodial Services Action Plan to implement cleaning protocols as recommended by health authorities. Cleaning protocols will focus on high-contact touchpoints, including door handles, elevator buttons, handrails, washroom faucets, water fountains, and garbage receptacles. These common high-touch contact points will be cleaned a minimum of twice daily by Facility Services custodial staff. In the event of a confirmed COVID-19 case within a university building or space, Facility Services will close and secure the area to be cleaned and disinfected. Signage will be posted to indicate the area is closed for cleaning. The area will be cleaned and disinfected in accordance with public health guidelines and procedures. Hand sanitizer is available in wall-mounted dispensers throughout university buildings, located in common areas such as main entrances and exits and elevator areas. These dispensers are maintained by Facility Services. Departments are responsible to provide hand sanitizer to frontline reception and service areas, or areas where hand washing facilities are not readily available, for hand hygiene between service interactions. The university's Facility Services Operations Group has established a COVID-19 HVAC safety plan to implement ventilation recommendations by governing agencies and public health authorities. Facility Services will also be undertaking necessary water system safety procedures when reopening buildings that have been unoccupied for extended periods of time. Other examples of infection control measures implemented at the university include active screening of individuals coming to campus, changing the way work or activities are performed, staggered start times or alternating schedules, restricting the number of people involved in specific tasks, restrict number of individuals in spaces or classrooms. The next part of the training provides an overview of how you can prevent the spread of COVID-19 on campus. Effective September 7, 2021, the University of Windsor will require all employees, students, volunteers, contractors, and visitors to have at least a first dose of a Health Canada approved COVID-19 vaccine and a second dose along with proof of vaccination by October 7, 2021. Accommodations can be requested for employees and students who have an approved exemption for medical reasons or creed religion under the Ontario Human Rights Code. The university's mandatory vaccination policy and associated procedures can be found on the Return to Campus website at uwindsor.ca/return to campus. Students must complete a self-assessment questionnaire via the SafeLancer app or a hard copy version prior to coming to campus, which consists of a few short yes or no questions. If using the SafeLancer app self-assessment tool, students will receive an approved or denied QR code and message, which is referred to as a badge, based on the answers to the screening questions. Any denied red badges mean you can't come to campus. A red denied badge results from your responses to the COVID-19 screening questions and/or an incomplete COVID-19 vaccination attestation. To attest your vaccination status and upload proof of vaccination, visit uwindsor.ca/vaccine. If you receive a denied result, students must follow the instructions provided, which are to stay home and self-isolate, complete the Ontario online self-assessment, or contact your healthcare provider. Report your illness absence to your instructor if you have face-to-face classes, and advise them you will need to miss class. Closely follow the directions of your physician regarding your return to class. Your instructor will put in place accommodations for you for any missed work or classes. When returning to your class, advise your instructor in advance. If you are required to self-isolate and you need support during this period, for example, you live on your own and you cannot access basic necessities, email studentexperience@uwindsor.ca and they will contact and advise you towards the appropriate assistance based on your needs. If you receive a green badge, approved, you are required to scan your badge at the QR scanners positioned at designated building entrances every time you enter a campus building or space. This assists with contact tracing in the event there is a positive case on campus. Building maps highlighting the location of these entrances are available on the Return to Campus website. RTC student ambassadors will be present on campus to assist and may request to see your badge. When on campus, students must wear a non-medical mask upon building entry, exit, and when in common areas. Practice physical distancing of at least 2 meters. Practice good hand hygiene and respiratory etiquette. We will cover each of these in the following slides. The university has implemented a non-medical mask policy, which can be found on the Health and Safety website. All individuals on campus are required to wear a non-medical mask or face covering when entering or exiting campus buildings and in common spaces where physical distancing may be difficult, such as entrances and exits, stairwells, hallways, lounges, washrooms, and elevators. Wearing masks outdoors is encouraged where social distancing is not possible. Wearing a mask helps to control community transmission and to protect the university community. Wearing a mask does not eliminate the need for physical distancing practices, hand hygiene, or proper respiratory etiquette. As per the University of Windsor's non-medical mask policy, masks are required to be worn in campus buildings and classrooms. Those who have mask exemptions will be provided with alternate work or learning opportunities and will not be able to enter a campus building or classroom. Students who are unable to wear a mask are encouraged at registration to choose the online or high-flex synchronous online sections of courses and labs. For the mask to protect you and others, it must be worn correctly. Here are some examples of how to not wear a mask. Do not wear the mask below your nose or so that it only covers the tip of your nose. Do not wear the mask so that your mouth and nose are exposed. Also, do not leave your chin exposed. When you wear the mask, ensure it is placed over your mouth and nose snugly, and make sure there are no gaps between your face and the mask. Refer to the video on the Return to Campus website on how to properly wear a mask. Physical distancing is one of the most effective ways to reduce the spread of the virus. The 2-meter physical distancing rule applies to all areas of the university, including shared or collaborative spaces, as well as other public spaces such as elevators and washrooms. Check the signs on the doors of these spaces for more instructions on what to do. To further reduce your risk of getting the virus, practice good hygiene and good respiratory etiquette. Because you'll often be using your hands to touch common surfaces like elevator buttons, door handles, and light switches, your hands are the most likely part of you to come in contact with the virus. Make sure you avoid touching your face with your hands, especially your mouth, nose, and eyes. Also, cover your nose and mouth when you sneeze or cough with a tissue or sleeve, and wash your hands afterwards. You should also wash your hands frequently throughout the day, especially before and after going into common areas, when you arrive at work, and before you leave work for home. Students are expected to wash your hands when you enter and exit campus buildings, interact with other individuals, come into contact with high-touch or shared surfaces or equipment, remove PPE or face coverings, cough or sneeze. Or, alcohol-based hand sanitizer can be used when hand washing facilities are not readily available. Follow the hygiene practices as recommended by local and provincial health authorities. Wash your hands often and thoroughly with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer. Sneeze and cough into your sleeve. If you use a tissue, discard immediately and wash your hands afterward. Avoid touching your face, eyes, nose, or mouth. Avoid contact with people who are sick. Stay home if you are sick. Avoid high-touch contact points, such as doorknobs, light switches, elevator buttons when possible, or ensure you clean your hands thoroughly after. If hand washing facilities are not readily available, use a hand sanitizer that contains at least 60% alcohol. Steps to follow are: apply 1 to 2 pumps of hand sanitizer to palms of dry hands. Rub hands together, palm to palm. Rub in between and around fingers. Rub back of each hand with palm of other hand. Rub fingertips of each hand in opposite palm. Rub each thumb clasped in opposite hand. Rub hands until product is dry. Do not use paper towels. Once the hand sanitizer is dry, your hands are clean. If you require clarification for any of the training material covered, or any other questions, you can speak with your instructor or contact the Office of Student Experience at studentexperience@uwindsor.ca. Students should continue to check the university's website for the latest information and updates regarding COVID-19. As the situation is continually evolving, the university will update its guidelines and instructions to reflect the recommendations provided by public health authorities and the latest internal adopted measures. Updates regarding the COVID-19 pandemic can be found on the university's Return to Campus website. Regular and frequent communications will also be sent in Return to Campus semi-monthly e-newsletter and bulletins, UWindsor's social media pages on Twitter, Instagram, and Facebook. For more information on COVID-19 and the university's return to campus, you can contact your instructor or the Office of Student Experience. In addition to the university's Return to Campus website, you can access additional resources and public health information from the links listed on screen. The COVID-19 outbreak has changed our daily work and life routines, and adjusting to this new reality is not easy for everyone. Remember to reach out, stay connected. Support programs are available for students through the university's Wellness Outreach Office, Student Health Services, and the Student Counseling Center. And remember, the My Student Support Program, or My SSP service, is available 24/7. Download the My SSP app onto your phone so you can access it easily when you need it. The university has provided links to mental health resources on the Return to Campus website. The Windsor-Essex County Health Unit's website also has a listing of local resources to support mental health in our community. Students have extended health and dental benefits with their student association. Contact OPUS, GSS, and USA for more details on how to access their benefits plan. This presentation was developed in consultation with the following resources. Thank you for watching.